My name is Amy Gray. I'm the Chief Executive Officer of the Undiagnosed Diseases Network Foundation. The Undiagnosed Disease Network Foundation is a new nonprofit organization. We launched the foundation last year on February 28, 2023, Rare Disease Day. And really there were two drivers for launching the foundation. One was to ensure the sustainability and the growth of the Undiagnosed Diseases Network, which is an NIH-funded research study, and the funding was sunsetting for that. So stakeholders came together out of concern that this incredible program that's been funded for over 13 years by the NIH may go away, and believe that a new business model would be very helpful for sustaining and then eventually growing the network itself. So the decision was made to launch a patient organization that was led by and for patients. But when the stakeholders came together, in addition to this, huge issue of funding sunsetting, they also recognized there were a lot of needs that the undiagnosed and ultra-rare disease community had, and that were not being met by other organizations. And I've worked in nonprofit healthcare philanthropy for over 20 years. I worked for some really incredible organizations, and it had never dawned on me that there wasn't one organization focused on the undiagnosed community and the ultra-rare disease community here in the U.S. There are internationally, and so a big part of what we're trying to do is create a community for the undiagnosed that haven't had a community to turn to in the past. Well, our mission is to improve access to diagnosis, research, and care for everyone living with an undiagnosed and ultra-rare condition. So those are participants that are enrolling in the Undiagnosed Diseases Network itself and the broader community. There are historically communities that have been underserved, that have been historically marginalized, and so we want to do everything we can to ensure that everybody, no matter where you live, no matter what your social economical status is, that you have access to the resources and tools to get a diagnosis, to participate in research, and to get the care you need to live a healthy life. And so that's what drives every new initiative that we launch, and every program that we'll be launching to support the community is that basis of our mission. The diagnostic Odyssey can really differ patient to patient, family to family. There was actually a study done last year by the Every Life Foundation that really helped better define the average diagnostic Odyssey for rare disease patients, which is about 5 to 7 years. Some families are fortunate to get diagnosed much quicker, and some families are still waiting on a diagnosis and can for a lifetime. So we really try to help families regarding what stage they're at, get access to the resources that can help them get a diagnosis, to engage in research, and upon a diagnosis to really set the stage for next steps with therapy development. So the timeline can differ really family to family, patient to patient, but the families that do get enrolled in the Undiagnosed Diseases Network are those patients and families that have literally gone doctor to doctor, seen specialist after specialist, had test after test done, and they're still looking for answers. So of the patients that have been enrolled and accepted, and these are the most pressing, challenging medical mysteries you can imagine, 30% receive a diagnosis coming through the Undiagnosed Diseases Network. We're currently working on strategies, though, for those that don't get a diagnosis to start a new undiagnosed cohort initiative where we can continue to reanalyze and resequence the data that we have on these patients, working with industry, to kind of bring in new innovative technologies and test those out to see, what can we do to get answers for these families, but also finding ways in which we can share data with other external data sources. There are a lot of companies that are doing genetic testing and sequencing, so establishing partnerships with those types of companies where we can share de-identified data and potentially find some matches. We will really overturn every stone we can to try to help families get an answer. About 80% of the families that come to the Undiagnosed Diseases Network have a genetic condition. 20% do not. We would like to continue to expand access to the network and expand that beyond just genetic conditions to encompass environmental conditions and environmental triggers that are causing diseases. About 60% of the patients that come through the network are pediatric, they're children. We also see adult, patients. So we want to continue to create awareness about the network. It's probably too good of a secret, in some ways, in which not enough people know about the network itself. So a big part of our foundation's drive this next year is to create awareness around genetics counselors, amongst healthcare professionals, to really try to get the word out about the opportunity for patients to enroll in the network. But we're also working on a new tiered approach for the network that will allow us to expand capacity beyond the current, capacity constraints we have, using some really cool new AI technology that's been developed by a couple of the principal investigators within the network. And what that will allow us to do is take all the medical records that are submitted for every patient, and we can be talking about 10,000 pages of medical documents that come in, and leverage this AI technology to sift through them and then have that reviewed by clinicians and researchers, which will free up the clinicians and researchers that we have in the network to spend more time seeing patients and kind of leverage those large language model and that kind of technology to find some commonalities in the data that comes in, and hopefully kind of help format that in a way in which the clinicians and researchers upon review can come to some quick conclusions, or it'll illuminate some next steps for the research process itself. So we are, being a new foundation, we're just launching some of our first programs. We've just launched a patient navigation program. We've hired a team of patient navigators. These are nurses, these are healthcare professionals that have worked in other rare disease organizations that are helping patients and families navigate every step of the process of applying to the Undiagnosed Diseases Network, or helping patients and families in the broader undiagnosed ultra-rare disease community that need help, need support, are looking for resources on where can I get testing done, where can I get mental health counseling. We really customize the service to the needs of the family. So we just launched that program in March and have over 40 patients now that have signed up for this navigation service. On the other end, the Undiagnosed Diseases Network itself historically has brought in about 700 new patients a year. But with this new tiered approach that we'll be launching in the coming year, our hope is to go from having hundreds of new patients a year to thousands of new patients a year by expanding the capacity and access to the program. To engage, with stakeholders in the rare disease community and the orphan, drug community. We're really interested in establishing partnerships with companies that are doing innovative things in diagnostic testing and sequencing and genetic testing. We're looking to partner with companies that are interested in developing therapies for ultra-rare and nano-rare disease patients. We're interested in working with companies that are taking innovative approaches to AI and how that can help with diagnosis and therapy development. So, we envision developing taking the model of the Undiagnosed Diseases Network and really building on that, a learning healthcare network that will allow for the dissemination of best practices and standards of care that in the long run will both expand capacity and access to this network, but also in a very innovative and sustainable way. So we're working on right now some approaches to implement some new technologies, as well as really study the health economics that will ideally in time encourage payers, third-party payers, insurance companies, that we can save a lot of money if we can diagnose these patients and treat them much sooner, and that this model is a model that can be replicated across the country. And so that's kind of our big vision and what we're working towards in the years ahead.